I started Braintree when I was 27 years old. I bootstrapped the company for the first 4 years. And we were profitable every month. And then I raised money and we sold it for 800 million. And then I made 300 million of that. At the age of 34, I thought it's time to try to do something meaningful on that kind of multi-decade timescale.
So this is a review of tech entrepreneur Bryan Johnson's journey with hair loss. And Bryan Johnson has been doing a lot of work with anti-aging treatments and anti-aging technology. So this is a review of his journey and his personal story about hair loss.
I started losing my hair in my early 30s. And it's really hard to, with my genetics, it's very, very hard for me to maintain hair. So I've had to work very hard at it.
So that is a common age when people start losing their hair. They start noticing their hair thinning. Some people notice it earlier, and genetics plays a major role. So people don't know this, but it can come from either the mother or the father side of the family. So either side of the family. But when we see hair loss or balding on the maternal and the paternal, on both sides of the family, we usually see hair loss starting even earlier, even in the 20s. But 30s is a common age that we see hair loss starting, people starting to notice it and wanting to do something about it.
What is hair loss anyway? Why does our hair recede? What's going on? And it doesn't happen in women.
Yeah, I know.
Typically.
So that's not really accurate. So hair loss does happen with women. So we see hair loss in men and women, and it's not that it's very infrequent in women. Sometimes women don't seek treatment or don't seek consultation as frequently as men may with hair loss. They may just live with it, but hair loss definitely does occur in women. There are really good treatments for women. There's medical treatments, surgical treatments. So that is an important point, that hair loss happens in both. So that's not very accurate.
Yeah, it's really quite annoying that it's such a big problem. I wish I didn't have to pay attention to it as much as I do.
Why?
It just requires constant attention. And the technology is not that great yet. Like you're basically trying to slow the process. You're trying to improve follicle strength. You're trying to prevent future damage, but it's not like something like a gene therapy where with 2 injections,
your levels go up
3 or 4x the production of that critical biochemical in my body.
So that's both true and not true. So when he says the technology hasn't advanced, it really has advanced in certain aspects of hair restoration. So in medical treatments of hair loss, it's true, we're using the same medications that have been around a long time. Minoxidil or Rogaine has been around since the 80s. Finasteride, or the brand name Propecia, has been around since the 90s. And they're still very effective, so that's why we still use them. So that has not advanced significantly, but there are other medical treatments like PRP or platelet-rich plasma. That is a medical treatment where we inject your platelets, which have growth factors, that can help to stabilize and thicken your hair. But from the surgical standpoint, we have robotic technology. So we have the Artis iX robotic system, which incorporates artificial intelligence, and it helps to really optimize the extraction of the grafts or the follicular unit grafts during an FUE hair transplant procedure. So that has advanced. So while some of the medications that we still use has been around a long time and we still use it, some of the surgical methods and technology really has advanced.
It's not the case. There's technology people are working on for cloning. So you take a few of your follicles, you clone that, and you put them in. So basically like doing a hair transplant, but you're cloning, you're doing your own hair. So there's other technologies that are emergent that are promising. They're just not on market yet. So yeah, it's hard. And it's like as a man, being bald is a meaningful thing, right? Mm-hmm. It's a significant psychological situation.
So hair cloning is a really exciting advancement that they are doing research on. There's a lot of research at Columbia. There's research in London as well. They're doing a lot of research into whether you can take hair follicles and clone them, and then you get as many hair follicles as you need or want, and then you just implant them, or whether or not there's some injectable progenitor cells that can be injected into the scalp that develop into hair follicles that then grow hair. So that hasn't really been worked out yet. In my opinion, we're probably about 8 to 10 years away from that being a reality, but I think we will be there and we will get there. So that's just something we have to be a little bit more patient with.
Would really struggle with psychologically, being bald, not being able to have erections. Those are like two of your top 5 things. And so I hope that the things I talk about publicly help break the stigma around it, so that people feel hope they can do something about it. They don't have to hide it. It's challenging and it's heavy to deal with it.
Your hair looks like it's changed as well since we last spoke. You look like you've got a fuller head of hair. What's been going on there?
The protocol I have is I do platelet-rich plasma every 30 to 60 days. So that is the process where you draw blood from a vein, you spin it up, and you separate the blood from the plasma. You take the plasma, and then we add A-cell and dutasteride. So it's a concoction of plasma, A-cell, dutasteride, and it's a total volume of between 13 and 15 milliliters. And then it's injected across the entire head, or in the areas that would be balding. And then I also do red light therapy daily, which we spoke about. Wear that cap for 6 minutes. And then I have a nightly concoction that includes a few things like minoxidil and a few others.
So that is a reasonable protocol. So there's certain oral medications that can be effective for hair loss. Finasteride is FDA approved for hair loss that can be taken. Minoxidil is a topical treatment. It also can be prescribed orally as well. Those are 2 common options. Some people use dutasteride, which is a similar compound to finasteride, but maybe a little bit more effective for some people as well. Dutasteride and oral minoxidil are technically off-label for hair loss, but they can be effective. Also, I use a lot of PRP in my practice, platelet-rich plasma. So when you separate the plasma from the red blood cells, you can't just take the plasma. There's a very thin layer between the plasma and the red blood cells. That's the platelet-rich plasma. And that's what's really important to get, because that's what has the growth factors. If you draw up platelet-poor plasma, or the plasma above that layer, then you're not really getting the growth factors. So if you take too high a volume, too much fluid, then you're getting more platelet-poor plasma. So you really want just the rich plasma the rich platelet-rich plasma that has the growth factors, and it may be a smaller volume, but it's going to be more effective for your treatment. So we talked about some of his hair loss treatments that have worked for him, the technology behind it. He's got some specific testing. There is an additional test which is newer that actually is a DNA test, and you swab your cheek and you send it to a lab, and it looks at specific your DNA, which makes up specific enzymes in your body, which determine how some of the hair loss treatments work. And it can tell you before you start the treatments whether or not these treatments may be effective for you. For instance, there is an enzyme called sulfotransferase, and when you use topical minoxidil, it has to be converted to its active metabolite by this enzyme. And if it's not converted, then minoxidil may not be that effective for you. So if you don't have good activity of this enzyme, then minoxidil, you may be using it for 6 months, a year, you may not get much benefit out of it. So this DNA test can really help to determine whether minoxidil may be effective for you before you even start using it. Also with finasteride or dutasteride, similar, it looks at the enzyme which is called 5-alpha reductase. And if that enzyme converts testosterone to DHT, dihydrotestosterone, and DHT is what causes hair loss. So finasteride or dutasteride blocks that enzyme and decreases the amount of DHT, and that's how it works. So this DNA test can look at that enzyme, and if your activity is actually overactive and that enzyme is working overtime and creating much more DHT, then these medications will even be, to go on them, will be even more effective to block that, and that's going to do even more for you. So it looks at those medications, looks at other things like latanoprost, other botanical products as well, and it can give you a good synopsis of what may be the optimal treatments for you. So that's something new technology-wise We can personalize hair loss treatments for individual people, so that's really good. PRP, platelet-rich plasma, that technology is continuously improving. Hair transplants, like I mentioned, the robotic transplant technology has improved and will continue to improve. The ability to use artificial intelligence and to locate the hair follicle, the follicular unit graft, and in a millisecond be able to locate it, angle in the appropriate angle, go in at the precise angle and depth to get the best quality grafts, and then repeat that 500, 1,000, 2,000 times, however many grafts you need for the transplant, has really advanced. And I think the technology will continue to advance in terms of cloning and other technologies that'll come out. We'll have it. We just have to be patient. So some of these were discussed in this video, but there's other things out there as well. So stay tuned. We'll be talking a lot more about them.